Michele, the quality of life and living with cancer or living life after a diagnosis. So, Michele, I want to do a lot of coverage here. We're going to start with hair loss because we didn't go into that when you talked about chemo, but it's something people really, struggle with. How did you handle the hair loss?
Yeah, as I mentioned before, I remember when I was diagnosed, I was like, "Oh my God, my hair." Um, that was one of my first reactions. I used to have, well, hair down to like my shoulder, kind of like yours. So I was like, "Oh my God, I'm gonna lose it." But and then it started falling out, and I was like, "Oh," like it was so annoying. It was everywhere. And then I was like, I should just shave it. And so a lady came up when I was inpatient and shaved my head. Um, but a big part about it too, obviously emotionally, I was like, I'm gonna look, obviously I'm a cancer patient, but I was like, I'm gonna look like a cancer patient. And that's the looks part of it was hard to grasp. But I was, obviously that comes with, you're going through so much and then you're getting sick, and that's the least part of my worries. And it does take an emotional and mental impact because you do want to feel beautiful. But like having that support system too is just so key in helping with that. But I also did look into wigs, and I made fun with um had fun with it, I guess you would say. um I got a brown wig, like long hair. And then it was honestly so much fun. There is a little section at the hospital, and I got to try on all the wigs, work with a hairdresser. So that was a lot of fun. I learned about the upkeep and everything. So I wore that a lot through my like first treatment, or like I don't care. Like when people came to visit me, I just go bald or wear a hat. I got very into hats. I have a collection now. And then my aunt actually gave me another wig that was like short. So I'd be like, ooh, new day, new hair. So yeah, it made it fun. With a emotional, like, oh my God, my hair is gone, to like now it's fun. And then the third time I was like, or my third wig. So when I relapsed, I got a wig. I was like, ah, I'm just gonna go for it. I ended up getting a blonde wig. Yeah, long too. I was like, this is just, I'm just gonna make it fun. But yeah, definitely at first like hard concept because if you look like it, like I didn't wear any makeup. You don't want it to react with your skin. But as time goes on, it you understand it more emotionally. It's fine. Like no one cares at all.
I love that you just went for it, and you're like, let's have fun. Like, this is a
Yeah.
chance for me to do something I wouldn't have done before. So, you're talking about identity, it's like this change in identity, the impact of cancer on your identity. Another part for people with identity is their work. It's like you pour a lot of yourself in it. And so how did you approach deciding whether to continue with work? I know you went part-time, full-time, you took time off.
I guess a little, I think, different thought process since my first diagnosis and my relapse. So first diagnosis, again, with the transplant, you're at home 100 days, like not socializing. The world was normal. So I really just did want to get back into work. But obviously not pushing myself. So I had my transplant September 7th, 2020, and then I went back to work part-time in January. And then even my employer was great. They let me ease into it, no worries. I ended up having to go back to the hospital inpatient for a week. Um, then took some more time, and then eventually able to start full time. But they eased me into it, which is super nice. Obviously, if they were having it be like a lot more rigorous, I guess, I would have taken more time on part time. But they let me have the option, which I thought was phenomenal. And then second time post relapse, I think also from having 2 transplants, I kind of steadied myself, so I took a little longer, like, leave time to return from the transplant. October 30th, 2020 was my transplant, and then I came back in April, then did a month part-time and then full-time. So the first time is so nice because you're getting back into normalcy, so I just wanted to feel normal, and then the second time, I think I took a little time, A, because second transplant, but B, like, with COVID, I couldn't leave the house till I got vaccinated in May, so I was home anyways, so yeah, didn't feel the rush to go back to normalcy.
Actually, just talk about being diagnosed so young, that experience and finding that cancer community.
Being young was probably one of the hardest points, um, for me emotionally. Just when I first was diagnosed, even, I remember being like, I thought just older people get cancer. I know obviously that's naive, not true at all. Um, but I was like, I'm healthy, I'm young, like I just don't understand. And I just wanted that clarity of, are there other young people out there who have cancer? I just want to know. Or with my diagnosis, it's just like a lack of understanding almost, but also just I just felt blindsided by the diagnosis too. So I just wanted to find someone else who I could relate to. So as I mentioned, just like meeting someone else in the hospital around my age was extremely nice. So we kind of ask those questions, having the same diagnosis and also both being young was just comforting in general. And then now kind of later on, um, especially with social media, not as much, but the Leukemia and Lymphoma Society, they have a connect program too, where I can touch base with other people who are around my age group. And I just actually recently joined it like a month or two. So I'm excited to kind of know more people around my age. Like, wish I knew it during the time of when I was going through treatment, but I'm glad to know it now, just to give you that extra comfort.
Thank you. And hearing all of that, shout out also to right like programs that help people with connection. So you talked about LLS before as well, and I think that's a great shout out to give. Speaking of age, you're 24, when you get diagnosed the first time. And I'm so glad that your medical team was actually the one to bring up fertility preservation because it varies for people. But describe first, why it's so important for you in that moment when you're thinking about it. I have to do this, and what that was like.
That too was obviously a shock. I like A, the diagnosis, and then B, having that, I just didn't even realize. But they did a great job. Like, it was something they addressed right away. And as mentioned, I switched hospitals to do it. It was too late to do preserving eggs. So the next best option was preserving my tissues, which will produce the eggs. The fertility doctors all came in, talked to me about it, discussed it with me. So it's nice to hear just their knowledge on the concept and have the appointments. But pretty much after my first 2 rounds of chemo, when I was first diagnosed, a month later, I came in. That's like my first time in anesthesia, but they knocked me out and then just got some of my tissues. And I remember too, also when I was like getting wheeled into the surgery room, that one of the or anesthesiologists, sorry, she was like, "Oh, my dad he had or some type of leukemia," and she was like, "He just found a donor, or he had a donor, and he's looking to like find where it takes like 2 years if you get a random donor from the registry." So she's like, he's looking on like finding out who his donor is, and it like gave me a positive light on that aspect. But yeah, the surgery part and just having that whole concept of the fertility issues was definitely difficult to grasp, but understanding that there's other options out there too, in the future. It's just, it's part of what happens, and who knows.
We were talking about the development of science and technologies, and I think fertility preservation is one of those areas that gets better, and hopefully will continue to get better. So what you're talking about, for other people if they want to look it up, is ovarian tissue freezing. So, and I actually hadn't heard of it before you talked about it. So I'm so glad to learn from you. um, so if anyone wants to look that up, that's there. Anything else you want to say about sort of the impact? I mean, you're so young and having to confront these sorts of
Mhm,
things that you wouldn't have normally. It's just this cancer bringing it to light now.
mhm. Definitely think it taught me a lot about perspective and just understanding. It's a lot, especially at this age. I'm still, I mean, I moved back in with my parents after I relapsed, like, and you think it's like at such a, I mean, every age is critical, but like this is when I'm gonna live on my own, like looking like gonna get married. Where am I choosing my city? But it also makes you think, like, I have such a great support system. I'm truly loved. It was a very difficult time, and there's still hardships, and there still is, but I learned so much from it about myself, like how strong I am, like my emotional understanding enhanced, and I understand what my body needs physically and just mentally. So you learn just a lot about yourself and gives time. And I'm part of the reason, as I mentioned before, about meditation, why I'm a huge proponent is we all go about our busy schedules, all about, I mean, I do too, all about ourselves, and taking that time, having that perspective and taking it back, not to think about anything, relax, realize what is important in life, see that positivity. It changes your mind, and changes your just understanding. So I think that, as terrible as it was to go through this, I have, it changes my outlook on life, and realize how important each day is, and how much love there is out for each other. And you never know what someone else is going through. And just having that understanding and that empathy. I watched a great video on empathy, I'll have to share, but having that empathy for one another, and it makes our society so much better.
I wish I could just broadcast that over and over again. I don't have to do that. What a beautiful message, Michelle. I now I just have two more quick questions, and then I'll open it up to you. But self-advocacy, I think, is another really important message that people love to share. Did you feel like you had to be your own advocate at times during this entire experience? And what's the importance of patients advocating for themselves?
I think that's a huge part. At, I mean, even like as I said before, my family's in the medical field, so they obviously have an understanding, but their body isn't going through it. Like, they don't understand. Even when I talk about, yes, someone will say I'm so strong, but they don't understand what, like, I went through exactly, or when I know something is wrong. Um, so even like the blood clots, like I I knew I had, like, the second time around, I was like, I know I have it. Like, I need to get an ultrasound. So I was the one who suggested I need an ultrasound to my doctor. So very much like advocating for yourself is extremely important. Like, obviously, no, blood clot can be very dangerous, but that's just like a simple example. You know what your body wants, and all the medication that you're taking, it interacts differently. Like, doctors have a certain regimen, a standard of treatment, but your body is different from someone else's, and it will react differently. So you know when you need certain medications or need extra help, and no question is too dumb to ask, or when you need something. So don't be afraid to, like, speak up. So advocating for yourself is extremely important.
My last question to you, Michele, is, as you are here sharing your story today and being so open, being so vulnerable, why is it so important to share the patient's story?
I think it's like beyond, like, I obviously like saw out like this. I just think for my when I was going through it, I would have loved to see someone's vulnerability, as you would say, like that openness that I'm going through something that someone else, that relatable, that empathy that you have, it just brings peace of mind to me. And I hope to bring that to someone else. It's something I sought out for and wish I had a little more. So I feel like it's only my like due diligence or duty to help others who are going through the same experience. It's so much impact on you emotionally, mentally, physically, that having someone else going through the experience just helps you cope with what's going on. So I want to share my experience as much as possible. It's in regardless of the diagnosis, cancer affects everyone. You probably have some type of family member, yourself, or anything that have gone through this experience, and it is a terrible, but you learn the love, you relate to people, and I think that people, the more knowledge is the more power. So having that advocacy is so important.
Well, you just described it as like a duty, and you certainly did not have to open up and share in the spirit of helping people. But it is so wonderful that you sought this out, really, Michele. And I'm so excited to be able to, push your story, spotlight it across all of our channels as much as possible, because I think it'll be so inspirational for countless people. So, Michele, thank you so, so much for sharing your story with us.
Of course, it was so nice to talk to you and meet you and share my story and everything.
Yeah, and we'll be in touch. I consider you a new
Yes.
friend. And we can bond over the memories of Lovenox and giving ourselves injections.
Oh God.
And for everyone else, who's interested in Michele's entire story, just head to thepatientstory.com, where you will find human answers to your cancer questions.